This morning, a student of mine asked a question because she knew I will talk about the effects of our thoughts on our mental health. And she asked, can we erase painful memories? And I replied to her, why would you like to do something like that? I told her to listen to the seminar. I will talk about it. So let me ask you this question. Can we erase some memories? This is one question. And on the other hand, the other question is, even if you can, would you like to erase it? So this is for everybody. On the other hand, let's talk about some things that we know. For example, I started to talk to my discussion with psychosomatic symptoms. That's kind of proving the relationship between brain-mind problem. One of the reasons of this having psychosomatic symptoms is people cannot find anybody to express themselves. This is very important, guys. Finding somebody to express yourself. In this busy city life, it is very difficult to make new friends, and it is very difficult to continue friendship. And it is really much more difficult to find someone who will listen to you without making any judgment. This hurts very much, actually, because when you find someone to talk, those people may want to make some judgment about what you do, and that can hurt people. So in this case, it must be very plausible to find a professional who can help you, a mental health professional who can listen to you without judgment. And actually, I have to tell you guys, a good psychologist is the one who talks the least. Keep it in your mind. One reason of these psychosomatic symptoms is that we have some things to talk, however, we cannot find a place to bring it out. We cannot find anybody that we can trust to bring it out. That's another important issue, trust. You will turn into someone whom you trust to. This is very important, whom you trust to. So therefore, one of my suggestions here is, like, in order to protect yourself from psychosomatic symptoms, one thing that we should do is to find ways to express ourselves. Talk about whatever we need to talk. Bring out those negative things so that they will not stay inside. Because, like, I can give you a good analogy for this. Imagine a spray container. I'm just looking if I have something like this. I don't. Imagine a spray container. So there is some amount of gas squeezed into that container. So therefore, when you press at the top, the gas comes out. These negative feelings, if we don't talk about them, if we don't bring them out, stay in us like the squeezed gas in that spray container. And eventually they come out as neurotic symptoms. Neurotic symptoms such as catharsis is one of them. All of a sudden, you cry. Or it can come out as neurotic disorders such as depression, anxiety. Those are very common. Why? Because we don't talk about our needs. Because one reason is in this busy life, we cannot find anybody to express ourselves. Social support, guys, very important. Another factor that protects us from any kind of negative life outcomes. We know that social support is one of the best protective factors. The support that you get from your family members, that's the most important one. Because even if something goes wrong outside, when you get home, there are people who are supporting you, who are behind you, whom you can trust to. It is very important. However, also I have to say, social support that is coming from your colleagues, co-workers, from social friends is also very important. It is also very protective factor for mental health and also for physical health, such as psychosomatic symptoms. And on the other hand, the autonomy is a very important issue, guys. We learned this when we talk about Erik Erikson's psychosocial development. Many of you may remember this from Erik Erikson's second stage. The crisis is about autonomy, guys. And autonomy is awareness and the feeling of doing something on your own. If we can raise our children, our youngsters, with a sense of autonomy, they will trust to themselves. In other words, they will have some kind of self-esteem about what they can do in life. This is very important. And actually, it is a very protective factor about the negative environmental outcomes. So people who have autonomy, who have strong sense of autonomy, will know whatever they can accomplish, whatever they cannot accomplish. When they start to a project, they can finish it. It is a very important well-being factor because the person knows his, her ability in doing something. On the other hand, if the person doesn't have a strong sense of autonomy, the person will start to a project, but he or she will have some kind of discomfort. Am I going to finish it? How am I going to do it? So, and in a social psychology class, we talk more about this, about how to achieve sense of autonomy in development. The fourth thing that I would like to mention as a protective factor is forgiving. In positive psychology, we talk about this very much, actually. We know that forgiving is a protective factor for negative thoughts. Let me explain it this way. If we cannot forgive somebody, that negative thought stays with us. And we are kind of feeding that negative thought in our minds. We are feeding it. On the other hand, if we can forgive the person, look, of course, it might be very difficult in some senses. Okay, I can understand that. However, if we can find a way to forgive this person or this situation, whatever is the situation is, then we are saying bye-bye to that negative thought. It doesn't remain in our mind anymore. It doesn't take a space. It doesn't use a space in our mind anymore. So therefore, we know that forgiving is a protective factor for mental health and also for physical health. Mental health and physical health is very related, guys. That's why I am kind of using them together. Yes, that's all for me. Do you have any questions? Although understanding is very difficult because how are we going to locate a certain memory? Guys, I want you to think this. Do you remember we have gold standard measurement assessment devices for the brain? They tell us something about the brain. However, memory is more about the mind. Remember, your memory is what makes you you. It is unique. So how are you going to locate a certain memory to erase? A comment about hypnosis. Can we use hypnosis to erase a memory? I haven't heard anything like this or anything about some other way to erase a memory scientifically, guys, because it is very difficult to locate a certain memory. We don't have any screening procedure or screening technique for that yet. But we know that if we do some lesion in the brain, damaging the hippocampus, for example, we can erase memories. However, that will be very pathological. But here, what we are talking about is to locating a certain specific painful memories to erase it. So far on Earth, there is nothing like that, scientifically, okay? And on the other hand, the second question, would you really want something like this? In my opinion, I wouldn't want. Because just like one of our friends said, a painful memory comes with an experience. So when you erase the memory, you're also erasing the experience of it. So you erased it. What happened? Now you're also losing the way of tolerating it. The same thing can occur again. The same bad event can happen again. Now, how are you going to tolerate it? How are you going to manage it? Because you don't have any tools that you used to have with the experience. You erase it together with the experience. Now, if the same thing happens again, you will be affected the same way again.